My name is Nancy McConnell-Maxner. I work for Nova Scotia Health, and I'll be moderating the conversation. A couple of things. I hope you had a chance to walk around and see some of the information and talk to some of the leaders in the group around programs that are happening. I also wanted to mention that this portion of the event will be videotaped and available for anyone who's not able to join, or if you want to rewatch it later, it'll be online for you to see through the same link that you've registered for a session tonight. In terms of the process and how we're going to flow the afternoon, we will have some opening remarks and some information shared from our leadership team locally and provincially. And after the opening remarks, we'll have question and answer period. Some of you will have submitted questions already, and so we have those questions. But most of the time, we really like to go to the audience and gain questions from you. So in order to keep that kind of working well, there's a couple of things we try to do. We have roaming mics, so you don't have to get up out of your chair. We'll just ask you to put your hand up. I will point to you, and what I try to do is make eye contact and then point, and we do the little nod, and you say, yeah, it's me, and then we point to the runner that has the mic. Sometimes there's lots of hands up at once, so I ask you to be patient with me, please. We try to get everyone that we can. And the commitment we make is that if you don't get to ask your question in this forum tonight, or today, this afternoon, that you write it on the card that you were given when you came in and put your contact information, so an email or a phone number, and someone will get back to you and answer your question. So I say that at the beginning because as we get toward the end, sometimes we're running out of time. I don't want anyone to feel like somehow they missed that opportunity. Someone will get back in touch with you. I would also ask that if someone has asked a question or a really similar question as you have, if you could let someone else ask a question, because what tends to happen if we get too many the same, it's hard to get the breadth of conversation, and I feel like this is this opportunity for us to hear from the leadership team about lots of different things. So if you've got a question that's very similar to someone else's, that maybe you could write it on your card and someone could get back to you personally. So with that, I think that kind of covers the process. I'm now going to call upon your MLA, Colton LeBlanc. And I'm reading because he's got a long list of, he's the Minister of Service Nova Scotia and Internal Service, the Public Service Commission, Acadian Affairs, Francophonie, and the MLA for Argyll. Thanks.
Thanks so much. It's great to see so many people here this afternoon to take part in this community conversation. Before I offer a few remarks, I do want to acknowledge that we are in Mi'kmaq, the traditional territory of the Mi'kmaq people. It's great to see so many folks to take part in an important conversation, a conversation that impacts each and every one of us in different ways, and that's healthcare. And I want to introduce our guests this afternoon that have taken the time to come from Halifax and have been doing these community conversations in many communities across our province. Running a little bit late today, but for good reason. Minister Thompson and CEO Oldfield had a significant announcement that I'm sure we'll have an opportunity to discuss this afternoon. So this afternoon we have the MLA for Antigonish, my honourable colleague and friend, the Minister of Health and Wellness, Michelle Thompson. She's joined today as well by the Deputy of Health and Wellness, Jeannine Lagassé, as well as the interim CEO and President of Nova Scotia Health, Karen Oldfield. So again, thanks so much for coming and taking time out of your busy schedules today. It's a really positive thing to see so many folks engaged in this important conversation, and of course our commitment as a government to move the needle in the right direction on this important file. So thanks so much and have a great afternoon.
Thank you, Minister LeBlanc. Before we start, I would like to acknowledge your MLA, Zach Churchill. I saw him when I came in. Zach, I'm not sure where you are, but I know you're here. There he is. Yeah. So that's our colleague across the hall, and so it's nice to see Zach here. And yeah. So my name is Michelle Thompson. I am a registered nurse. I've been a registered nurse for about 30 years and worked in healthcare right up until I was elected for the first time in August of 2021. So I'm new to politics, and I'm learning as I go, and certainly was very privileged to be appointed as Minister of Health by Premier Houston shortly after we formed government. So one of the first things that we did when we formed government was we embarked on a different type of leadership. So Department of Health and Wellness is the policy maker and the funder for healthcare, and Nova Scotia Health and IWK are the operators for different, for grown-ups and kids. And so we decided that we would have Nova Scotia Health and Department of Health form a leadership team. And that's been a very important step for us. So for the first time in the history of our province, the funder and the operator actually sit at the table on a weekly basis, at least, to look at how we can make decisions as a system, as opposed to two parallel entities. And so that team consists of Deputy Minister Lagassé and CEO Oldfield, as well Janet Davidson, who's really a thought leader in healthcare in our country. She is a registered nurse, and Dr. Kevin Oral, who is an orthopedic surgeon. So we're really grateful to have that team. They meet weekly, but they talk daily, sometimes 50 times a day is what I would say. So it's been a very good, approach, I guess is what I would say for us. So the next thing we did as a leadership team is that we traveled around the province, and we started in Neils Harbor, and we came here to Yarmouth and all points in between. And we spent time speaking to healthcare professionals who are on the front lines. We had ideas about what we thought would improve healthcare, but we spent 4 days traveling around the province, trying to hear directly from healthcare workers in all different aspects of healthcare around what they felt would be most beneficial. And the feedback that they gave us informed the first healthcare plan that we've had in really over a dozen years, if not more, and it's called Action for Health. And Action for Health is 6 pillars, and we'll talk a little bit about those today. And it also is accompanied by a website that talks about where we are and what are the things that we're doing and how we're moving those objectives forward. Sometimes we update it quarterly, sometimes annually, just depends. And so we continue to work very hard towards improving healthcare in our province in all ways. And so today, it's our privilege to be able to sit here and talk to you and answer your questions and give you some information about some of the actions that we've taken and where we think we will be heading in the future. So I'm going to turn it over to Jeannine, Deputy Minister Lagassé, to say a few words. So I just really look forward to the discussion today. It's really important. I think this spot is 17 of 19 or 20. We've got a couple more to do. And so it's been a very, very, it's just been a privilege to be able to go into communities and talk to people directly about the things that are on their mind. So I'm really looking forward to it today. So thank you.
Yes, so thank you. Good afternoon, everyone. I just want to echo the minister's comments. It is a real privilege for us to be out in communities like this. As Nancy has kind of set out, we've set it up so that we'll give out some information to you about initiatives that are going on, mostly in your zone, so that you really understand kind of what's going on in your local area. But then through the question and answer, it's a way for us to have a conversation. And that's really what we want to do, is have a conversation with you about what you're seeing, what you're hearing, what you're experiencing, because we've learned something in every community that we've gone to. And we take the ideas back, we take the questions that have come in and go through them. Sometimes in the car on the way home that night, we talk about how we can implement something, or the next day, Karen and I have a conversation about what we can do. So just really it's open. We've had questions about everything you can imagine, and we're more than willing to take them and hope that you'll learn something this afternoon and that we will learn something from you. So thank you.
Good afternoon. Just apologies for being late. I had to grab this stress ball on the way down the aisle here because we were kind of a titch fast on the way. So anyway, not too fast, no. So two things. First of all, I just wondering, with a wave of hands, how many either current or retired healthcare workers we have in the room. Just a lot. And it's really interesting because as we've gone around the province, it's really been anywhere from 20 to almost 50%, depending on where in the province we've been. And so I'd like to start simply by saying thank you for your service, for what you're doing, what you may have done in your past careers. And I also like to remind others that, This pandemic's been going on now for coming into 3 years. At the beginning, if you remember that far back, there were pots and pans being banged everywhere. People were like heralding our healthcare workers. There were Tim Hortons cards. There was all kinds of good stuff. And so I just want to first start by saying thank you. And I applaud you. So thank you for what you have done and what you do. And just remind us these are hard jobs, and it hasn't been getting easier. And particularly in the Western Zone, it's been a very tough go. And so it's double appreciation. The second thing I'd like to do is ask our Western Zone leadership team. So we have our VP of Operations, Tanya Nixon, our Medical Director, Dr. Cheryl Pugh, Allison Lamb is here, and I just wonder if you would please join me in whether there's an on-site local person too. Tanya, I don't see you. Oh yeah, there. I just couldn't see that far back. Sorry. So if you would like to come up and just perhaps start with a very brief overview of where things are and going in Yarmouth, I would appreciate it. So we'll start with that. Oh, you get a big team here. Okay, great.
Good afternoon, everybody. As Karen said, I am Tanya Nixon. I'm the Vice President of the Western Zone. And for those of you that don't know, I spent 12 years in the southwestern part of the province, 10 living not far from here. So lots of really familiar faces. I have been away outside of the province for the last 7 years. It is really exciting to be back. I have heard a lot from many of you in this room and outside of this room. Oh, yeah, sure. And it is my pleasure to be here with the Western Zone team and many of the local leaders here in Yarmouth. So as Minister Thompson, Deputy Minister, and the CEO indicated, we've really spent a great deal of time meeting with people in the community, meeting with our staff and our providers, and listening to learn. Areas of focus for us include staffing stabilization. Recruitment and retention is extremely important to us. We cannot lose one more provider in the system, and we most definitely cannot in our most rural areas of the province, and this area in particular. In addition to recruitment and retention and staff stabilization, access is really important to us. So things that we've done over the last year and a bit, we've introduced virtual care in our emergency department here. We've looked for ways to increase primary care access. I know many of you have heard and have visited our mobile primary health care units. We are trying to increase primary care clinic access here as well, and we have a very comprehensive access proposal that has been drafted, has been presented, and we're really excited that we hope to be making an upcoming announcement that includes us partnering with community providers, DAL family residency providers, as well as our acute care providers in the hospital. The other thing that I would say is in rural parts of Nova Scotia, emergency health services has been incredibly important. We've been working really hard with our colleagues at Department of Health and Wellness and EMCI, EHS. I know we have colleagues here in the room today. We have added non-urgent transportation options in the system. That really has enabled us to free up emergency access for people who need really acute medical transportation when they need it. I do want to acknowledge, in addition to my colleagues here at the front, we have a number of providers around the room today: continuing care, mental health, primary health care. Thank you for coming. They all have a wealth of information, service details. If you or a loved one are looking to access service, please don't hesitate to reach out and ask some questions. We do have someone here who can help us with accessing virtual care. If you do not have a provider and you are waiting to gain access to a provider, virtual care is one of a number of options for you, and we do have someone here who can help you with that today. Lastly, before I introduce my colleagues, we really have tried to increase the ability to have local decision makers who are working with staff and people like yourself to make decisions. So about a year and a half ago, we made the decision to have Tracy Watkins-Allen become the site lead here in the zone. Tracy supports the team, both the frontline staff, the volunteers, the physician providers, and is the liaison with the community agency. So if you don't know Tracy, please take a moment before you leave today to introduce yourself. So without further ado, I'm going to pass it on to my friend and colleague, Dr. Cheryl Pugh.
You hear me? Hello? I think you've got it now. Thank you. My name is Cheryl Pugh, and I am an obstetrician gynecologist. My clinical practice is located on the South Shore. I will say that I have had many opportunities to practice obstetrics in Yarmouth. It's a wonderful community. We have done a significant amount of work to ensure that your patients, obstetrical and gynecological, do not need to travel for care from this area. It's been very challenging from a resource point of view, but we've done, I think, a good job so far. My job is the Western Zone Medical Executive Director, so I am part of Tanya and Allison's team, and basically we liaise with Dalhousie, Department of Health and Wellness, and the other partners, including community partners, to ensure that we provide the clinical care to you that's required. A couple of initiatives that Tanya didn't mention that I'm just going to highlight for brevity. I would like to identify that we have a physician recruitment team member, Dr. Michelle Dow, who's actually local to this area. She's an excellent addition to the team. She has been identified as somebody who will help us to bring some family practitioners to the area, Southwest Nova, and we're really hopeful that she will be able to add to the team. The other initiative I'd like to bring to your attention is the Family Practice Anesthesia Initiative. The Yarmouth area has been challenged significantly with respect to our ability to address surgical strategy initiatives, and we have difficulty with retention of anesthetists in this area. So it's a pilot which we've started. It will begin in March of this year. We have 2 individuals who actually have local ties to the area. We're very hopeful that this will be a positive initiative and that it will be something we'll be able to maintain the surgical access for you as patients who require care. I think I'll stop there. Pass it to Allison.
Good afternoon, everybody. Nice to see you. I'm Allison Lamb, so I'm the Executive Director of Health Services and really have responsibility and accountability for the 3 regional sites in the zone, so Yarmouth Regional, Valley Regional, and South Shore Regional. And I work very collaboratively with Tracy. We're on the phone on a regular basis, and I'm here very often in really working to deliver the services within the regional facility. So we have worked a lot in the last little bit in increasing our surgical services here, in addition to the GP anesthesias that Cheryl just referred to. It is looking at visiting physicians coming to deliver care here, so the people of Yarmouth don't have to travel. We've also increased some of our peri-op services at Valley Regional as it relates to orthopedics. So there's lots of work happening in the zone, and I'm not going to steal all the good thunder that Tracy Watkins-Allen and Dr. Joe Gillis, who lead Yarmouth Regional, have done. So I'll hand it over to Tracy to speak, and then we'll continue down the line. So thanks for everybody coming out today.
Can you hear me? So like they said, my name is Tracy Watkins-Allen, and I'm a Health Services Director in Western Zone and the site lead here at Yarmouth Regional. I'm responsible for the strategic and operational leadership at the site, and work collaboratively with the clinical and the physicians at the site, as well as the support services and some of our partners. I see individuals from our Yarmouth Hospital Foundation here today as well. So I have lots of people that I do work with, external partners. I first want to thank everybody that works at the hospital for the things that they do each and every day, because I couldn't do my job without them. We have a great group of individuals who show up each day and do the work that's necessary. I also want to recognize our physician leaders who provide care to the community, but are also engaged in this strategic and operational work. So they do go well above and beyond, in my opinion. Some of the things that we have done, and I did do a little note, but Tanya and Cheryl have shared some of them, but again, the virtual emergency in our emergency department, we are able to see lower acuity patients during the day, so that does help decrease the wait times in the emergency department. the virtual care, which there is somebody here with Joanne's team to be able to help people who are unattached, don't have a primary care provider, to be able to access that care for free, the virtual Maple platform. Primary care mobile units, which we have one coming this weekend actually in Yarmouth at Harbour South. So just if you're looking for a prescription refill or those sorts of things, great opportunity. We have looked at allocating of surgical beds so that we can provide care for those needing elective surgery. During COVID, just due to occupancy rates, we were prioritizing those urgent cases, cancers, those sorts of things, but now we're trying to work through the backlog of elective cases. They talked about the GP anesthesia program, which is phenomenal. Like I said, I work with the foundation, and their support is very much appreciated. They provide equipment regularly each year that we probably wouldn't be able to procure without their support and the generous donations of you guys in the community, so that's appreciated. We have partnered with School of Nursing to kind of look at how can we retain some of the nurses that are at the school that's practically right in our parking lot. So looking at, rural nursing bursaries, as well as we've implemented an undergraduate student nurse role. So students that are in the program, while they're studying, they can also work casually, which gives them clinical experience plus employment while they're doing their studies. Because of significant deficits within our nursing program, our nursing portfolio, we have utilized travel nurses. So we have been working with a significant amount of travel companies to make sure that we have the nurses that we need to be able to provide the care. And we've also had to look at, and I know public tableau is out there, if you look at the data, our acute occupancy rate is around 130%. So if you visit the hospital, you will see people potentially in hallways and unconventional spaces, but it's us meeting the needs of the community. I saw Bob was over there, so we do work with our partners in continuing care to make sure that people are aware of resources available out in the community to hopefully keep them at home longer so that they don't need to come in hospital and wait for long-term care placements. We want to keep people home, make sure that they have the resources that they need so that people are getting the care they need and by the right provider and in the right space. I guess, again, I just want to recognize the work of the team every day because I really feel like they get the brunt sometimes of the frustration with wait times and access, and ask that when you do access the system that you remember to be patient and kind because they are going above and beyond.
Can you hear me? Oh, okay. Hi, I'm Darlene Davis. I'm interim executive director for rural and community health in the zone. So I'm responsible for the rural community sites, so Digby, Middleton, Fisherman's in Lunenburg, Queens, and Roseway in Shelburne. So I don't want to really repeat a lot of what's been said. I think what we're focused on, folks have already captured, but similar to what Allison said, working closely with Tracy on a daily basis, I work very closely with the Director of Primary Care, who will introduce herself in a second. And a lot of the initiatives, like I said, that we're working on have been mentioned, but we're really focused on recruitment, retention. The more people we can get in the door, the more services we can expand on. And so we're really focused on increasing our services, trying to fill in some of the gaps with these mobile clinics that you're hearing about, and really, focused on providing more care for you. And I just lastly want to say it's really heartwarming to see a great turnout today because it's really great for us to know that you care so much about your community and your health care. Thank you.
Thanks, Darlene. Can everybody hear me? Hi, as Darlene mentioned, my name is Joanne Wenzel, so I'm the Director of Primary Health Care for the Western Zone. So that what that really means is I get the great privilege of working with family practice teams across the zone to support them to strengthen their team complement, for them to focus on access, and above all, and we've all mentioned it, the recruitment and retention is really important. So again, my colleagues have mentioned a lot of things, but from an access point of view, again, Virtual Care Nova Scotia is a really great option, and I'm mentioning it again because if you haven't accessed it before, one of the really unique features of it is a wraparound. I call it a wraparound service. So in that Virtual Care Nova Scotia appointment that you might have, if between you and your physician or nurse practitioner feel that you need a physical assessment to address your needs, we do that at the primary care clinic in Yarmouth. That's located in the basement of Yarmouth Regional Hospital. That's one of the functions of a primary care clinic. So if you think about having that virtual appointment with a provider and then those next steps around what you might need from a physical assessment and support, we do that kind of referral process so that you can be seen right in this community. Again, focused on access, our primary care clinic has grown from a really tiny service to quite large, actually, and the primary care clinic is about supporting people for access to primary care who do not have a family physician or nurse practitioner. We know we'd like to be open and be larger in the number of appointments that we're able to offer, but we are constantly growing. So a tangible example would be, in the last little while, it's all based on provider availability, but we're 160 to 200, a little over 200 appointments a week that's available for folks who do not have a provider. So I'm in the back, so if you had questions, and Melanie's there too around the primary care clinic, we're happy to answer those. The other thing I'd mention is that ongoing schedule with mobile units. So you'll see in your community, and I appreciate any feedback, how to spread the word about the mobile units, but we are really working on a regular schedule for Yarmouth, and we're also just at the point, probably today or tomorrow, to share that we'll have a mobile unit in Pubnico probably next week. So that's really important because we're really trying to address those gaps. Recruitment and retention is really important, and often I get lots of questions about nurse practitioners. I'm sure that's the same theme. We really value nurse practitioners as part of our team. Probably everyone in here might probably know one of our nurse practitioners in Yarmouth. They're wonderful, and I really need to thank them because they're really trying to meet everyone's needs. So they're building a practice so that you have that regular connect with them. They're also helping out in some of our gaps as well. So they pop into a mobile clinic. We also have support from other clinicians across the zone to help staff those mobile clinics, so it's great. We really focus on community too, so even the partnership, not sure if Trish is here or not today, with the Tri-County Women's Centre, we have nurse practitioners that come on a regular basis to support that well women's piece. We'd love to grow that, but that's a really important part of our partnership. And thank you. There's lots to share, so I'll stop now though.
Okay, well, thank you. And so now we'll start with our question and answer portion. And again, we'll go through, I'll ask you to put your hands up and we'll try to get to, and I'm going to say this multiple times over the evening or the afternoon. If we don't get to everyone, please put your name and your contact information on your card and submit it so you can get that here back. So I think I was going to start with reading a question, but I see lots of hands up really quickly, so I think I'm going to pause on that. And I'm going to do my pointing. And again, I'm going to do my apologies. And it's funny, my mom drove with me. I'm from Pictou County. We drove today, and I always feel that rudeness of the pointing. You shouldn't point, but I'm going to point. So there. Yep, you. Yep. Yes, you. That's probably rude too, but I don't know sure who our mic runners are. Just one sec. Right here. Okay, right here. So Tamara's get you.
First of all, I'd like to thank everyone here, the panel for making the effort to listen to our community's concerns, and the members of the community who are here to listen or to participate. After watching these meetings online, I have some concerns about whether the panel is actually hearing some of the concerns of Nova Scotia. There's a gap between listening and hearing, and there were long talks about teams and zones looking ahead and working potential and launching and exploring programs, challenges, targeting, emergency preparedness. And these kind of made the divide a bit obvious. Most of the answers, or some of the answers, did not connect with the questions being asked. I say this as an introduction to my question, and I look forward to a real answer, highlighting reasoning and science. Namely, why is Nova Scotia not bringing back our own nurses? These men and women have ties to their communities. So the retention argument with them is moot. They want to be here. They worked tirelessly through the worst of the pandemic, literally not knowing how dangerous this virus might be. They were on the front lines for a year, and you, our government, called them heroes. No one was in a better position to decide if this injection was appropriate for their well-being, and yet you have demoted them from hero to zero for taking steps for taking steps they honestly feel is better for their health or for the protection of their soul. And this is important. Let's face it, cloned, aborted, feed material is creepy at best. And anything which plays against God's design for the very blueprint of life is a major affront to a lot of people. With the evidence available today in your own department showing that the injection has no appreciable impact on this or on any virus, 82% of people have had the injections and 82% are dying of COVID. This is kind of a tell. Pardon me, I'm not used to public speaking. Right now, we have recent graduates manning entire floors of the hospital with no experienced nurses on hand. We have LPNs manning long-term care facilities overnight, which is when the most serious events tend to occur. By excluding our experienced, homegrown, never gonna leave nurses from their jobs, you're putting lives at risk and asking people to make decisions they're not qualified to make and who can be stripped of their nursing licenses if they make a mistake. Add to this the threat of a demand for yet another injection is adding to the stress of those in our hospitals and long-term care facilities. I'm in contact through several groups with nurses around the province who have decided this is going to be the hill they die on. A return to mandates, a forced third shot will decimate our nursing staff. Those who take comfort in shots and boosters should be free to do so without fear of retribution. But those who feel that their health or their soul is better served without it should also be fear of retribution. This is a highly personal matter and this should be recognized by our bureaucracy. Again, I say hearing over listening. There's no shame in admitting you were deceived by the WHO, the UN, the illustrious Dr. Fauci. It was confusing and frightening time for all of us. Our health overseers definitely tried to do what was best for the people of Nova Scotia. And it may be time to admit that not all the information you were operating on was accurate. Not all of it was presented with honesty and care. Heaven knows this is a small province with limited resources. You needed outside help with the research and you needed outside advice. But now you have your own data to work with. I would ask that you listen to the real facts that are now showing the truth about both this virus and this injection that's being pushed. Thank you. Had to deal with many of them. We have some unbelievable nurses in in Yarmouth, in this area. And we've lost a lot of them, and that's a shame.
I do want to thank you for the comment and the way that you expressed it, extremely empathetic and knowledgeable, and obviously from the number of claps of a very heartfelt and important issue in Yarmouth. I'm just giving you the NSH numbers. I can't talk beyond NSH, but I can tell you that there are 128 of 26,000 healthcare workers who work for NSH who are not vaccinated at this time. Okay? 128. Now, so our decision all along has been that vaccination would be required for those who work in high-risk settings. And that does include hospitals, but also other high-risk areas such as long-term care. It's a very polarizing issue here and in other parts of the province. So the decision is not being revisited at this time. However, There's always tomorrow, and there's always the day after. So that's not perhaps the answer you want to hear, but at this point in time, that's the policy, and that's where we are. And it's so, you know, I appreciate the sentiments, and I do hear you. And we will take this back, and we do after pretty much every meeting. So I will never say never, but today it is not a change in our policy. So thank you for that.
Okay, thank you. Do we have another question? And so just a reminder, we want to make sure that we're covering lots of different questions. So we have someone here. Do you want to? Okay. Oh. Okay, I'm sorry, I didn't see you.
So first off, I am one of those nurses that is not vaccinated and that has lost my job in this province that I worked very hard for and have a $60,000 student loan to boot. I have my personal reasons for why I do not want this vaccine, which should be a choice, and my own personal convictions. I've been told from my employer that I don't have the right to my conscience, to my religion, to my creed. What? I don't care what they say. Now, Michelle Thompson is here. I've wrote several emails. My mother, a veteran nurse, RN for 47 years, who also walked in the mandates. We get the same automated response back signed by your assistant, and our questions are never addressed. One, why? What is the scientific evidence that you're not allowing us back to work? Every other province in this country has allowed their unvaccinated healthcare workers back to work. Number two, the vaccine has proven it is ineffective at transmission. We've seen that. 1 week we had 800 healthcare workers off with COVID. I can pull up your very own provincial statistics today that over 82% of COVID hospitalizations and deaths are in the vaccinated. I can give you exact numbers from the government's own webpage, okay? How long do you plan on leaving us on unpaid leave? How long? How long do I have to continue to suffer? This has been the worst year of my life. I have lost everything because of your draconian, unethical, and ineffective mandates that do nothing to mitigate transmission of COVID. The proof is there. All the proof is there.
So I can answer, again, I appreciate that this is a very divisive conversation, and I can feel it in the room. And I appreciate your comments. I'm not in a position to argue science here today.
Because there is no science behind this. That's why. It's going, there's no science behind this.
So we're not
You can kick me out if you want. I've already lost everything because of you guys. Everything. And my health has suffered as a result.
So this is not something...
This is righteous anger is what you're seeing here right now, today.
Okay. So we're probably not going to solve this here today. And this is a conversation...
Okay, well, I would like the question answered. Why are we not allowed back when every other province is allowed back?
I won't be answering that question today.
There you go. The science. What is the science behind it? When it's been proven that this vaccine does not mitigate the spread of COVID. It does nothing to stop the transmission of COVID. Your very own statistics, want me to get them up here right now on the provincial government
we're
site?
going to move on. I'm not going to answer that question here today.
And that's what you get here, folks. That's what you get. But stay away from the boosters. We are seeing the side effects. You can shake your head all you want. This is what we're seeing. Yeah.
So
I know people who have lost loved ones. I will not stop speaking up. And I have been listening to the doctors and the scientists that have been speaking up, not to the ones that are bought out and toting this narrative of control.
And I'm going to say thank you for your comments, and we're going to go on to another topic. And I would, again, just...
It's exactly what I
appreciate
expected. No answer.
I
No
appreciate
answer, because
that
they
it
don't
is-
have an answer.
And there's clearly a lot of passion in the room around this, and I think that we probably won't get to an answer today. So I'm hoping if you've got a question that's maybe on a different subject line, if you would like to put your hand up. Now I'm going to start doing my pointing thing, and I'm going to count off. So I did see 1 and then 2. So we'll do you 2 in a row, and then I'll come up to 3, and then somebody in the back is 4. Oh, okay, maybe 5. We'll see. We'll see how we go.
First of all, I think it's despicable that you come here to field questions and don't answer them. But I'm here to talk about a different topic. I'm Charles Daniels. I'm a chiropractor. I've been running my clinic here since 1981. My question is, when? Can you hear me better now? My question is, when will the rules change to allow the same policies in the rest of the province that exist in the HRM regarding chiropractors being able to requisition x-rays? Should I elaborate on why that's important?
Well, you can, but I can give you an update if you'd like.
Please.
Okay. So we recently met with the Chiropractor Association, and I know that, to your point, HRM have been allowed, and there have been other chiropractors in small pockets across the province who've been able to order x-rays. And so actually we are working right now with them in order to enable chiropractors across the province to order x-rays. There'll be some work around order entry and making sure that you can get the results that you require as well through the share process, but that is actively happening between the Department of Health and the association right now.
Why are you dragging your feet on this? Why is that happening like today?
Well, it is happening. They could be talking about it today, but I know that we had a meeting in the last couple of weeks, and they've committed to work together, and we're going to get back together to find the updates. So we do have an MLA who's a chiropractor, and he's quite engaged in the conversation as well, and so that is...
I'm happy to hear that you're receiving. I'm certain it's a very good presentation. But sometimes time is of the essence. If I suspect fracture or bone cancer, sometimes having the studies done promptly is enormously significant. And I can tell them to go see their MD, and they might get in within a week, and then there's another couple of days before they have the films done, and then another day before the report is sent. And sometimes that kind of delay is life-threatening. And that's the best case. A lot of people don't have a medical doctor. And that's a higher percentage outside of the HRM than it is inside of it. So why to discriminate against rural Nova Scotians when you know that this is effective in other places in the province is beyond my comprehension. For someone who doesn't have an MD to go to emerge and then wait to be x-rayed, and the triage nurse is going to put them way at the end of the list because they're not like necessarily suffering or anything, this is ludicrous. So I would like you to answer my question, which is, how come that's not happening toot sweet?
So I can't say any more than it's happening. We're working with them to make sure that we have the rules in place, and we work through the association, and we expect that in a very short period of time you will be able to order x-rays. And I can't give you the exact date, but I know that we're actually working on it now.
Well, thank you. I'm happy to hear that you're on the case. Just one further comment. In 41 years, I've sending people to their medical doctor to have the x-rays done. They've never turned that down. The MDs have sometimes had to phone me up and ask why, and which is their due diligence. But this is wasting my time. More importantly, it's wasting the physician's time. Most importantly is delaying prompt studies to patients who might need it urgently. So, and it's costing MSI money for them to go to see their medical doctor or even an emergency, like then MSI gets billed. If they see me, it doesn't cost nothing.
We agree.
We agree. We're with you.
I'll shut up.
We totally agree. We're having a violent agreement here.
Oh, actually, I think the
We
next...
agree.
We heard it when we were in Port Hawkesbury, and we came home and we immediately put the wheels in motion to make it be so. We agree.
We agree.
Yeah. So I think...
Yes.
Sorry, were you next question? Oh, I think... Sorry.
41st year.
Hi.
Yes.
Hi, I'm...
Well, it's done.
4 Tories, 4 Liberals, and 1 NDP, and this is the first time I've heard anybody say that they might even vote.
No.
Hi, I'm Luann Link. I'm a nurse for 40 years. I'm a counsellor in Clark's Harbour. I lost my son August 1st of 2021 because of the healthcare system, because there was no mental health care. He was admitted December 23rd for less than 24 hours, not diagnosed, medicated, and no follow-up. I couldn't get the family doctor to follow him up. Our mental health care needs to be in the community, and we need a mental walk-in clinic like you have in Halifax and Cape Breton. And why is West Nova Scotia always the last to get it? And the doctors were given money not to see their patients. They got like $110,000. My son died because he never accessed an appointment. Have you ever had to go and take your child and do CPR on them? That's what I had to do, me and his father. That we have to live every day of our life missing him and knowing that he didn't get the care that he needed. Mental health is true. You fellas have not said anything about mental health. We need mental health in the community, and we need peer support. It can be any way that it can be done, but it needs to be done. And if we had that addressed, we would have less drug addictions, because that follows suit.
First, I'm very sorry to hear your story, and I absolutely applaud your courage for standing up and telling us today, because that takes a lot of courage to do that in this forum. No. Absolutely, but I want to applaud your courage for telling that story today, because I'm not sure that I could do that. So thank you for bringing that to our attention. You're absolutely right that we need to deliver mental health services in a different way. We do have now one of Minister Thompson's colleagues, Minister Brian Comer, is the Minister just of Addictions and Mental Health. That's solely what his responsibility is. And one of the things that he's been mandated to do is look exactly at this issue of how we provide services in a universal way. So we've tended to think about mental health care as inpatient, psychiatric, kind of higher levels of care that we need. And sometimes people do need that care. And when they do need it, it does need to be ready and responsive for them. But there are also lots of things that we can do in the community with our community-based organizations, with organizations that are already in existence. So we're doing a number of pilot projects right now that are starting exactly for that, so that when people perhaps, you know, as they start out, if they're struggling a bit and need some help, to your point, there's peer support, or there's social workers available, or there's other clinicians who are available, so that hopefully that it doesn't progress to a place where they need to get more psychiatric or hospital care. So you're absolutely right. We are looking at, and so we want people to understand, universal mental health care is about a whole continuum of care, from the very early stages until to very acute illness.
So that's what he died from. I feel like I'm responsible because he didn't get the help that he needed.
Yeah.
Like, I mean, who's going to compensate us for the loss that we've lost? I could have lived the rest of my life living with that.
Totally. Absolutely. And if you'd like to chat individually after, more about your experience, I would be happy to chat with you after.
Okay, thanks. There's someone in the back here, and then someone up in the front here. Oh, okay, and so back there with your hand. Yep, you. Maybe stand up, maybe wave. Yeah.
Hi, my name is Shanna Grant. I'm the youth outreach worker with Shift Youth Services. This is more of a statement. My job is quite literally to advocate for homeless youth and youth at risk of homelessness. Access to affordable housing is quite literally healthcare. They're going to you folks with pneumonia, like we said, mental health issues. A glaring gap I want to highlight today, which we have been dealing with a very complex case since October of last year. Nowhere in the province, except for the AIS program at the IWK, accepts anyone for inpatient mental health care under the age of 19. I'm gonna cry. Because this youth that I'm specifically thinking of, a 17-year-old, because they don't have a permanent address, they can't be admitted to that program. There's nothing else. They can't come back to shift because we can't help them. They don't fit our mandate because they're addicted to drugs and they have many other mental health issues. My question is this even on anyone's radar, this glaring systemic issue? This youth is 17 years old, living on the streets of Halifax right now. So I just want to know if anyone's thinking about inpatient services for homeless youth under 19.
So I'll start. It is on our. It is on our radar. Absolutely, we're working across government. There's a number of things. So we work very closely with Minister McFarlane, who is the Minister of Homelessness, and Minister John Lohr, who's the Minister of Housing. To your point, looking at supportive housing models, and supportive housing meaning not just the structure. Not just the place for someone to live, but actually wraparound supports for individuals living with addictions and mental health issues, relationship issues in family where it really isn't safe for them to be home, and how do we navigate with them. There's a ton more work to do, absolutely, but there has been some early successes. There's also some work happening across departments with anti-poverty work, so really looking at the determinants of health and how do we support folks, because really, sometimes I say I'm the minister of the healthcare system and all of my colleagues are the minister of health, right? Around education and economic development and all of the different departments is a piece of health. And so we are working. We know that homelessness is significant and it's not just a city problem. We know that rural communities are struggling as well. So there's been some grant funding that's happened. We are trying to lean in. It would be great to speak with you and see if you're connected with the people that may be able to support the work that you do, because I think there is opportunity, and we want to continue. But Jeannine, there may be more. Is that okay? So if we could speak with you afterwards and make sure you're connected, but it's absolutely on our radar to support not just youth, but actually people who are without homes.
I'd like to add too. It's not an answer. It's just a comment, which is, when I look out and I see what's transpired over the past 3 years. I look at our youth, very young. I think we don't even know what's going to happen with respect to mental health. And I think that there's going to be so much more work that's required to be done, so much more effort. I think we're just at the very, very, very tip of the iceberg. And I personally am very concerned to make sure that, it's front row and center and that we are looking out. It's not just, it is today, but it's also what could be coming, and I really worry about that.
Okay, thanks. I know we have a question. I'm making Fraser run today. There's a question at the front, and then I see you've got a question up down here, so
sort of on the same vein with mental health, but a slightly different perspective on it. How do you specifically intend to address mental health care for our providers to help reduce burnout and stress leave and career changes because of it?
Now that's a great question. And I'll tell you that our minister is very much, this is on her radar. So you start and we'll chime in.
Yeah, so I think there's a number of things. I think, you know, when we look at, there's a couple things I think about. We think about those very stressful events that happen and how we deal with that as a team, right? So if there is something that's happened, a significant critical illness or a critical accident or something like that, so making sure that we have access to people to debrief in those situations and very clear access for psychological support in order to process and digest what people have been through, because it can be very traumatic. There's also the day-to-day grind of it all. There's the pressure at work. You know, we all have a lot of pressure in our personal lives as well now. And so we do have some programs like EAP. We do have programs through professional associations. So as an example, Doctors Nova Scotia spoke about a program that they currently are working through with physicians called Bring Back the Joy to Medicine. So looking at resiliency. For us as employer, or as the employer, looking at the things that really grind folks, so giving people agency over their work life as much as possible, supporting them. I don't think there's one thing. So peer support, making sure there's EAP, looking at wellness activities. We know that work-life balance is really difficult for people in healthcare right now. We have a number of vacancies across the province because of the workforce shortages, which means that healthcare workers don't get the rest that they need and deserve. And we're aware of that. And that's, you know, where travel nurses can be a double-edged sword. We bring them in order to make sure that our shifts are fully staffed and that the staff are supported or that they can get a break. But it's also difficult to see somebody that's not from your community that's getting paid a different rate for working alongside of you. So we hold that with both intentions, working with unions as well to understand. So there's a variety of options and really trying to support people if they do have to go off, but ideally we would be looking at prevention. So I think we need to go right back to the education and talking to people about resiliency and self-care and how we build that into our education programs for staff as well. And you know, I worry about all healthcare professionals. I worry not just, you know, it takes a lot to care. We carry patients with us our whole life. And then I'm reminded that some of our patients carry us with them their whole life as well. So it's, I think there's a lot more that we can do, but it is on our radar, and we worry about the people a lot. We worry and we hear directly from them.
Especially where us as patients have so little access to mental health care of our own, we tend to treat every care provider as sort of a therapist, which can be just adding to that.
It's such an important relationship, so thank you for asking that.
Okay, so I see somebody here, and then so we do have two in a row in this part, and then we'll go back over. Yep, nope, it's you. I know, it is you. Thanks.
I'm going to read mine, if you don't mind, because I probably would miss some very important points. So good afternoon, and I do appreciate you being here today. Canada has the dubious honor of being the global capital of euthanasia. My information is researched from government sources. Canada has killed more people with legal injections last year than any other country on earth. Many of them poor, homeless, or helpless. And today I read an article by CTV that Canada is performing more organ donations than any other country from the MAID donors. And soon, from March 23, lethal injections will be offered to anyone over the age of 18 who judges their mental health difficulties to be intolerable. Death is now to be treated as a solution to life's problems. At the moment, if mental illness is the only medical condition leading you to consider MAID, you are not eligible to seek medical assisted in dying. But under the new current law, the exclusion will remain in effect until March 17, 2023. So after March 17, 2023, people with a mental illness as their sole underlying medical condition will have access to MAID. if they meet all eligibility requirements and the practitioners fulfill the safeguards that are put in place for this group of people. As of late, we have been hearing on government-funded media that MAID has been offered to 5 veterans who suffer from PTSD. These are people who defended our country, and the best that our government can offer them is suicide? Shame. As of March 17, 2023, you will not need to have a fatal or terminal condition to be eligible for medical assistance in dying, and this will be available for mature minors. Most recently, a video was circulating by the clothing store Simons. The video showed Jennifer Hatch from BC, a young woman with a debilitating condition, choosing MAID as she sat next to a body of water and people danced around her. Jennifer gave her perspective of dying. So are we trying to normalize suicide? She actually found death care easier than health care. The government is now offering activity books. Rick, you can show them. Speaking about MAID to help those thinking about losing someone in their life. This is being offered to 6 to 12-year-olds. Is this not planting seeds in young minds that suicide is an answer to life's problems? Human life has become so devalued that it is now common practice to just decide to ask the government to provide suicide. What if a mature minor is having trouble on a certain day or week and actually seeks help? Will the solution be MAID? As most of us know, most mature minors can have their ups and downs as well as most people living today. My question to this panel, will MAID be the answer to Nova Scotia's broken medical system?
So no, that is not the answer to our medical system. We want to make sure that patients have the care across all ages that they need. To the previous person's point, we do need to look cross-government in terms of some of the challenges that people are facing around homelessness, around poverty, things like that. It is incumbent on us. My understanding is that the federal government has stood down and there is a delay in that law in coming. And yeah, so that is federal legislation. And so we will have to look when and if that is passed in terms of what that means for us in the province. But that's certainly, it is a choice for individuals. It's an informed choice, and there's a lot of checks and balances in place in order for that to happen. But I can't comment on what could potentially be until or if that federal law is passed. So we really, I would say, if you feel strongly about it, I think it's important that you reach out to your MP who would have insight and line of sight into that federal legislation. I think that's the first place to start. And then, you know, if it is passed, then it does come as a provider in terms of how we deal with it then.
Thank you. So we have a gentleman here, and then I know you had you were supposed to be my second question, weren't you? So I promise it'll be you. So right here, and then right here, and then okay. So 1, 2, 3. Are we seeing my runners? Are we good? Pink sweater. She's 2.
Thank you. Thank you all for being here, and thank you for what you do as well. I'm a past member of the Nova Scotia Seniors Advisory Council, and we had a committee brought up a report having to do with continuing care. I believe that the government's efforts so far in long-term care has to be applauded, but I think we can find efficiencies in funding and efficiencies in the betterment of the Nova Scotian seniors by having more and better continuing care, home care. I looked at a report coming out from Sweden. this particular individual was staying at home, and there were 6 individuals coming to his home per day. Now, we are lucky if we can get half an hour a week. We have to work on that. Thank you.
So thank you. Thank you very much for raising that. I do want to let you know, before I came into politics, I was the CEO of a long-term care facility. And so certainly continuing care is very close to my heart. So you're right, there has been some really good strides. We've increased the number of beds across the province, and it's going to take us a little while to do that. To your point, one of the things that Nova Scotia Health is working on in the city initially, but we'll look at how it works, is transition to community. So rather than having only one option of going home or going to long-term care, these transition to community facilities will allow us to have rehabilitative folks in that facility, different than rehab, but really because folks often will deteriorate in hospital because they're not moving around and doing the things that they would normally do. They can decondition. So it's a reconditioning place so that people can get on their feet again and we can start to transition them home. So we recently had the opportunity to visit Denmark and look at their system. Particularly strong support for seniors at age 65, whether you want or need it or not. You have someone phone you and they talk about your goals for the next year in order to prevent frailty, and they also do a loneliness assessment on you. So really understanding how you're connected to your community and making sure that people are connected. So Minister Barb Adams is a physiotherapist, and she's quite passionate about seniors in long-term care. And so thank you. I'm going to let her know that you spoke to us today. And if there's anything that we can loop back to you with around that advocacy, please let me know.
Please tell her that I'm around 4 on the frailty scale.
I often wonder where I am on that myself.
Okay, thank you. Okay, so we have 1 and then 2 and then, yeah.
I wanted to say thank you to the leadership team for coming to speak with us today, and to let you know that not everybody in the room shares the same opinion. We have a diversity of opinions here today. I want to make an observation, which is that 3 years ago, when the pandemic began, we didn't know what we were going to face in the next 3 years, and we don't know what it might have been like if it had been different. I guess so I want to say thank you I want to be grateful for the fact that we had one provincial leadership team in healthcare that was managing our health and the pandemic at the beginning. I think it's possible, if we were to have an imagination, that we could envision that it might have had a different outcome if we had been 9 health authorities or 3 or 4 district regional boards, or whatever iteration of healthcare we've seen over the last 30 or 40 years. So I'm really grateful that we were led by one provincial team. And now we're at a different phase in the pandemic. It's not over, but it's transitioning. And the question that I have for you as we transition into this next phase is, are you going to leave behind the individuals in this province who are immunocompromised? Because it feels as though we who have remained uninfected have become an inconvenience. And I'd like to know, going forward, because you have combined operations with policy, I feel it's appropriate to bring that question forward and ask you to what are you doing to protect the disabled who are immunocompromised in this province at this stage in the pandemic, when literally COVID is everywhere?
I'll try and answer that to the best of my ability. So I think what we've all learned as a result of the pandemic is infection prevention and control principles that perhaps were not as mainstream. So in my work as a registered nurse, as an example, if we had someone who was immunocompromised, perhaps I'll give the example of chemotherapy in hospital. Sometimes post-chemotherapy, white cells drop and people are very at risk, as an example of getting an infection. And so as a result of that, we would gown and mask when we went in to provide care or anybody visited in order to protect the patient. And so while there is also our ability to protect ourselves through the various public health measures, we also know that we have to look at the risk of the people around us and use those principles to the best of our ability in order to protect each other. So immunization for us is very, very key, making sure that immunization is widely available and that it's accessible to people. That's the first thing. Anybody, that you have the immunizations that you require to protect you. We do continue to, we aren't masked here today because we can't hear us when we have the masks on, and we've gotten feedback from people that they can't. So in larger groups, if you feel that you're at risk, then you should definitely mask and use those principles that we've been using all along. We are at a place where it is choice. And the other thing that I would say is that what we've learned as well, not just through the pandemic, but through recent environmental disasters, more like Fiona and things like that, we need to have a better understanding in our community about who is vulnerable and how we support them. So I think one is using your own personal protective, the public health measures for yourself and the people around you. Two, I think we need to understand who is vulnerable in their communities when there is something unusual that we need to respond to, so that we can, and making sure that individuals who are at risk and who are isolated because they are immunocompromised have better connections, like we talked about around continuing care. So I think there's a lot of work that we need to do in order to support people who maybe aren't able to, for their own health reasons, be out and about as much as they were prior to the pandemic.
So, yeah, up here. Okay. Actually, no, we have somebody up here, but I'm just checking my scan around to see who's next on our list. But sorry, I think we see. Yep, you're good.
Again, like everybody else, thank you. I am thrilled to see women and nurses in these positions. I think it'll make a huge difference. I see lots of excellent, or hear lots of excellent plans. Follow through being the crucial thing. I am a retired nurse, so I have spent many, many years listening to plans and not seeing the follow through. So that is the important thing, is not the talk, but the action. My question is about, I just read it this morning actually, about the patient advocates and the care providers in the emergency departments. So just a little more information about that role and, what qualifications, etc. I see a perfect opportunity. As I said, I'm a retired nurse, but, I'm reconsidering that. But I don't want to do those 12-hour shifts and the night shifts and etc. I've been there, done it, put in my share of my years. And I heard a song on the way here today, and the title of the song was Somebody's Someone. So in those emerge departments, everybody is somebody's someone. And so I think that if you, we can't, it's a huge piece to fix the system. We all know that. COVID exposed a system that was already practically in the toilet. So we can't fix it, and in a short period of time. But I think being able to share information with those patients that are waiting, so those few staff that are in the background trying to care for them, they want to take that time to have those explanations. They don't have the time to do that. And so if you have those kind of people that can provide that, I think it just helps everybody cope a little bit better.
Exactly.
And I'm available.
And I should have brought the sign up. Yeah. Should have brought the sign up sheet. So two parts. So before we came here, we participated in an announcement this morning of the deputy and two others did a technical briefing, and the minister and myself had the pleasure of doing the media, and we should really talk about it, because there were some bits that pertain specifically to Yarmouth, like the fixed wing, but I'm going to let you talk to that. So the question dealing with the weight room care provider, clinical, and the patient advocate, comfort. So I'll speak to that first. So we've had in the province, you know, a volunteer program for many years. It manifests in different ways depending on where you are or what site and so on and so forth. So it went away during COVID, very unhelpful. Started to come back in October. Our volunteer patient advocate, volunteers in the waiting room. But we need to take that to a whole different level. So I'm calling it professionalize our patient advocate. They could be volunteers, but they may not be. They could end up being paid positions. We want somebody in the waiting rooms focused on people's comfort. So it's water, it's a blanket, exactly. We want to look at you and see you and help you. You're there, you don't feel well to begin with, more than likely. So, you know, I was in the, I'm going to come back to the specific answer, but it's such a good example. I took a little time on Saturday night and just went through the emerges in Halifax. I went to the HI, I went to the Dartmouth General, I went to the Cobequid. I live in Halifax, those are the three I went to. And there was a young fellow in the emergency at the Halifax Infirmary, and he was running. He was getting water, he was getting blankets, he was, can I help you, how can I help you? And I asked him to have a moment, and he was a first-year student at Dalhousie University, and he was doing a 4-hour volunteer shift. And he said, you know, that man, he just went down to the vending machine, and he spent $3 on water, and I have water. So what I'm going to do, Karen, I'm going to go make a sign now that says what I have and what I do. Okay, like, good for him. But he shouldn't have to do that. We should be doing that, and all of that should be on a piece of paper, on a chart that says here's what's available, here's what our patient advocate can do, and not only that, by the time we're done with this, they'll have an iPad that can tell you your approximate wait time is whatever, X. So, you know, that's not going to happen as of Saturday, the iPad, but the people will be in the waiting rooms this weekend. So that's on the care and comfort. They're not clinicians. They will not diagnose. They won't do vitals, none of that. So then we come to the second component, which is the waiting room care provider. And that will be a clinical person, and they are part of the care team, part of the team working in the emerge, but their specific role is to ensure that there's assessment, reassessment, making sure that from a purely clinical perspective that there is line of sight to people in that waiting room. So those are the two components. I don't know if you wanted to add anything else. So basically what we announced today was that's happening now. I think
okay.
Yes.
Yeah, just one more thing. We mentioned the fixed wing, which will have an impact here. So Deputy Lagassé will tell you about that.
Yeah, just quickly, as part of this morning's announcement, something that will have direct effect for here in Yarmouth is we're instituting a second fixed wing aircraft with our EHS Life Flight program. So I think a lot of people are familiar with the helicopters that we use in emergency situations. If we have something where we need to move someone quickly from one of the regions into Halifax, into the tertiary center. So that will continue. But we currently also have one fixed wing that is used often for transport purposes, the same as we would use often an ambulance for transport purposes. So we will have a second fixed wing that will be doing transports between Yarmouth and Halifax and Sydney and Halifax. And what we've estimated we will be able to do is, in using that second aircraft for that purpose, is we'll have the effect of having the equivalent of approximately 5 more ambulances on the road based on the number of hours that we know ambulances take to transfer patients between those locations. So we think it will be a very positive implementation for your area that will allow us to have more ambulances out on the road, and for patients to have a quicker transfer to and from Halifax when they need to have tests or other interventions done there.
Go ahead.
Thank you. First of all, thank you for being here and listening to us. Can you hear me okay? Okay. My quick question on masks. Somebody recently asked me if I would take a Kleenex or a piece of paper towel, cough in it, sneeze in it, and then attach it to my face and wear it for an hour. Now, I know it sounds disgusting, but if you stop for a minute, that's kind of what we've been asked to do over the last 2 years anyway. A couple of quick things about masks before I ask my question. Turns out a virus is very small. If you compare it to the cross-section of a human hair, it's 1,000 times smaller than a human hair. So what does that mean? Well, that means if you're breathing through this thing, the virus can go through it either way. It just passes through it like it's not even there. And if you look at anybody wearing masks, you'll realize that they don't fit that closely anyway, especially under the eyes and at the cheeks. There's all kinds of freeway space there for a virus just to sail through. So the other thing that you probably are aware of, but I'll point it out, that there has been no scientific studies that ever prove wearing a mask made any serious difference as far as viruses. Now, if you go online, you can find all kinds of pros and cons, but at the end of the day, the masks don't really work. And they don't work mainly because of the size of them. So my question to you is, knowing these things, and I know you guys are aware of all this stuff, why are you still pushing masks? And by the way, before you answer, I don't have any problem with people wearing masks. As a matter of fact, I mean, I know a lot of people feel better if they're wearing a mask, and I have absolutely no problem with that. So I'm not reflecting on anybody who wants to wear a mask. But this idea of trying to tell, especially young children, the effects on them, you know these things better than I do. Okay? So my question is, why push the masks? Thank you.
So masking now is a choice. We do recommend them in gathering places, but it is a choice. They are still mandated in high-risk settings where people are frailer, so our long-term care facilities, which are congregate living settings, as well as hospitals. So I think for the general population, for those of us who are in community, I think masking is one way. In public health, we often talk about the Swiss cheese model, and so it is one effort, it is one measure. There's also to continue with social distancing, and even my friends that had personal space issues prior to the pandemic seem to finally get that 6-foot space, which I'm deeply appreciative of. Hand washing, good cough etiquette, those types of things. And all of those things layered together are the things that protect us in community. And so for some people, those things are very important. And for some people, those things are not as important. And I think at this point, one of the most difficult things in the pandemic is for us to be respectful and compassionate with one another and appreciate that there are, very polar opposite ideas about things, and then there are some folks that are in the middle. So I think what I always try to do is make sure if I have someone around me that is wearing a mask, I ask them if it would be their preference that I wear one. I try to be respectful of others. I wear them when I go into congregate settings. I do those things. So it is part of a number of measures, public health measures, and it does continue to be in our congregate living settings with our frail elderly folks, as well as hospitals, and I foresee that happening for a long time.
Okay, thank you. So I have one, and then two in the front row, right? You have a question still? Yeah, so one here, and then if we have time, we'll get to others. So we'll start, I lose track of numbers, so we'll just keep an eye on you. So one and then two for sure, and then I know I saw you up and you up, so if we get to everybody.
Good afternoon, everyone, and I do thank the panel for coming. A lot of good information, certainly a lot of passion, frustration, and rightfully so. I can't get over, unless I'm real strange, I am in that 25%er. I stood with a convoy, and I make no bones about it, rather proud about it actually, because we got a country going to hell, but we're going to stay on topic with health. Pertaining to the mask, my brother here pretty much touched on some of the points. My wife and I watched the junior hockey games in Halifax and in New Brunswick, and only to see 11,000 strong in the Halifax arena, and the only masks I seen were the goaltenders. Now, again, I'm like my brother. I'm not here to make anyone feel, and he had a good questions as to where is the science. I watched Doug Ford, blubbering Doug Ford, step up to the mic the other day in his press conference. He had his mask on. He stepped back, wobbled it up 4 or 5 ways, stepped up again, put it back on. I don't know what he was wiping, but it looked more brown than anything. So you got to question, where in the hell is the common sense in some of this stuff? If we go back in time, first we started out with a little jab will do you. Well, we had our little jab, and then there was light at the tunnel, 2 weeks to flatten the curve, another jab, a booster, a rooster, maybe a hen or a cow, who knows? But where in the hell are we, where's the common sense in some of this? I'm just a simple woodcutter. That's what I did but I shake my head at the stupidity of, and how we the people can stand back and swallow it. And the question I have is anyone considered the pandemic of fear that's enveloped the world? The pandemic of fear, is that not maybe it's time we've done a medical study on fear and a mental study to where it's putting the people are petrified by you, so I don't want to be rude, by you experts, because I know you're doing the very best you can do, but I'm frustrated. I'm frustrated by all of you, the Bonnie Henrys, the Dr. Tams, the inconsistency in the no two provinces, no consistency in the messaging and whatnot. So again, I know you're doing your best. I thank you for coming. This is my daughter that stood up and give her testimony of losing her job. Absolutely senseless. And if you fellas got a little bit of a brain, you must know there's no damn common sense. And you know, that these people could not go back and work. And yet you're bringing in foreigners. And I got nothing. I'm not a racist or no against immigrants or nothing of the sort. But I'm saying, come on, wake up. We can do better than this as a province and as a country. And the darn medical suicide, I heard you say, it's going to be their decision. Well, if you got a 12, 14-year-old kid all screwed up, and it's going to be their decision whether they chose to do it or not. We're better than that. God Almighty, we're better than that. Wake up, stand up. Our damn country's at stake, and our rights and our freedoms. Wake up, everyone.
Okay, thank you for that. Sorry, now I've lost track of where, up here at the front, actually. I think this gentleman was next, and then one, and then two, and then.
Good afternoon. I'm going to go on a different topic. I'm going to hit the ER, okay? I'm a member of the Nova Scotia Prescription Monitoring Board. I'm here, I represent them here today. Oh, there you go. Yeah, okay, I'm a member of the Prescription Monitoring Board for Nova Scotia. I've been there for 11 years. But my question is, what's going on with the ER? With all the brains that I saw here today, to me, somebody is missing the boat somewhere, because the ER, there's a lot of people that don't have any doctors. They have to sit at the ER and take the patient, the time and the patient of a nurse practitioner, a doctor. Why don't you have a nurse practitioner trained in this field to go in the lobby of the hospital 1 day a week to eliminate the impact of people in the ER? To me, that's not a big brainer. Why can't the Department of Health do something more sensible?
We are.
I like to see it.
I know, we'd like to see it too. So we did have a big announcement about some ER improvements today. So you're right. There's a couple things there. We absolutely want to include nurse practitioners, and also in some ERs we can also include physician assistants. And what we know from the data, and certainly Karen's welcome to correct me, is that around 60% of the patients that are seen in the emergency room could actually be seen by a nurse practitioner or a physician assistant. So we do have some significant workforce issues. In order to be a nurse practitioner, you have to be a registered nurse first, and then you take on training. So we do support registered nurses in the province to bridge and become nurse practitioners, but we do have an absolute shortage. One of the things that that has recently happened, I think it was the spring legislature, we actually allow nurse practitioners to admit to hospitals. We're only one of the only jurisdictions in Canada that allow nurse practitioners to do that, and they're also allowed to discharge. So not only do we want to use nurse practitioners in the emerge, but we want to use them also to provide care for people who are more stable in hospital as well. So by doing these things, it allows us to attract nurse practitioners from outside of the province in addition to growing our own, because we can keep bringing people through the ladder, right? So if you start, there's a ladder in nursing. You can be a CCA, an LPN, an RN, a nurse practitioner. Those are our options as nurses. And so whichever one of those you choose, there's also usually, unless you're a nurse practitioner, there's another option that you might want to consider. But that's moving the same people through the system. And what we always need is people to come in behind and fill the positions that you vacated. So we need to attract and we need to grow. So we definitely are looking at nurse practitioners and their role and virtual care. And the other thing we want to do is look at the people who come to the emergency room who are not urgent, not emergent, nor urgent, and find a different place, whether that's virtual care or whether that's a mobile clinic or what have you, so that we can make, you don't need to go there, and that your waits are shorter and that you're able to access the care that you need. So we are absolutely in agreement. We need Karen put a call out on LinkedIn, and I think she had about 50 nurse practitioners who said, sign me up.
78.
So we are 78. So we're on it. You're dead on the nose. So yeah.
And I just would like to maybe add to that. Actually, it's a physician assistant can deal with a physician assistant, not even an NP. So they have different scopes, because the NP can actually admit and discharge and diagnostics and a few other things as well. But a physician assistant in an ER can actually deal with about 62% of cases that appear in the ER. I looked at your data last week from the mobile clinic here. And on Sunday, there were 76 visits, and 30 were prescription refills, prescriptions. So if the mobile clinic wasn't here, one has to assume that would likely have been in the ER. So that's nuts. That's just nuts. So we agree, and the issue is just, what's the right way to handle it? And so one of the other things that it kind of goes along with your question, but it's pharmacists. And yeah, that's your next question. So we're jumping ahead of you. So Jeannine hasn't done anything here yet today, so I think she should talk about pharmacists. No, she earned her dollar this morning for sure, but you go ahead, Jeannine.
Okay.
Sorry. I'm going to get killed for that. I'm sorry.
So our pharmacists in Nova Scotia do have one of the largest scopes of practice in the country, that for a considerable amount of time they've had the scope of practice to be able to diagnose and treat minor ailments and other things. And so there has been a pilot project through Nova Scotia Health and Sobeys Lawtons for a Pharmacy Plus, we've called it. And it's been a partnership where the pharmacy has also had access to a nurse practitioner, often virtual. But if the pharmacist could not assist the person, then there was an avenue for that person to go to. But starting in February, we're instituting some new sites. I think it's 14, I want to say, across the province, where pharmacists will be compensated to have additional clinical hours, to have a pharmacist there to diagnose and treat minor ailments. Because what we're finding is in a number of the pharmacies, the pharmacists are very busy. They have kind of their regular work, if you want to call it that they're doing. And so it's an acknowledgement that they have this large scope of practice. They can do a number of things that, again, would keep people out of the ER and be a lot more efficient for patients, right? So we're doing, I'm not sure, I would have to look at my list when we were done to let you know, where in this area of the province it's going to be. But if those projects, those demonstration projects go as we expect that they will, we would see hopefully that rolling out more consistently throughout the province. So stay tuned on that, but pharmacy has a large scope of practice, and there's a number of things that's where you can get diagnosis and treatment.
And I think we continue though. We continue with medical lab, with lab tests, and also pay.
Absolutely.
Yeah. Can I ask you another question then?
Okay, and we have a few more, so it's got to be a quickie.
A quickie? How come the province of Nova Scotia, when you issue a prescription, it expires after 1 year? Can't you do that like the other provinces? If you give a prescription, this way you save another problem at the ER or something else.
Yeah.
That's my question.
Yeah, so I think that's something that we can look at, and I think that's something that we need to look at with primary care providers. So there are some things that maybe it isn't good not to have things checked, to give you a 5-year prescription for medication. So we just, the nurse in me says sure, but at the same time I think about, as an example, what are some of the complications that the medications may cause? And so we're always trying to balance chronic disease care with the medication. So the answer is probably to create a team and a health home where you may not always have to see the doctor, but in fact, you might get to see the dietitian, or you might get to see the pharmacist, or you might get to see the family practice nurse. So somebody who can help you monitor that chronic disease that you need the medicine for, but in a more timely way. So you're not always waiting just for that doctor or just for that pharmacist, and that's some of the work that's happening. We need all providers working to support patients that have chronic illness. So, I'm not sure, is what I would say. It would depend.
Thank you. So we have one here, and then I'm looking at my time, and I know, so we have one here, and then probably time for one more is here. With, can you put your hand up? Sorry, can you put your hand up? So, yeah.
Okay, so I thank you for coming. I thank you for answering our questions. But I came thinking we were going to be talking about Yarmouth. And so far, a lot of the answers that you gave us and a lot of the money that's been appropriated goes into Halifax. And I know that's been in the newspaper. Oh, well, we got this money, it's going into Halifax. Another question to you is, our emergency room at the Yarmouth Hospital had money appropriated before COVID to fix it up. What's happening there? And the other thing with COVID, it's mutating all the time. So the pharmacies are actively trying to keep up with it and putting many of the mutations together to help us. I don't have a problem with that. My husband and I'm 74, he's 84, and I have several stories to say. When COVID started, my husband came down with COVID. And we were fortunate we have a family doctor. He said he needs to get Paxlovid. Does anybody know what Paxlovid is? It's if you're compromised in any way, you should get it. Now ask me if he got it. I had to try to fight for him to get it. Oh, well, there was tons of it, couldn't get it. He went by ambulance to the emergency, sat in the emergency ambulance for 4 hours. I said to them, and one of my nurse friends, can I at least get into the ambulance with him? And I was turned down by the nurse practitioner. I love nurse practitioner. My son is a nurse practitioner. So I'm sitting and waiting. Now we're really into all the hours. And here comes my husband out the door. And he says, oh, hi, I've been looking for you. I said, yes, here I am. At which point, a nurse came running after him, yelling at him and saying, I'm not going to be following you all over the place. At which point I said, he has dementia. Oh, and I said, I'm the primary caretaker. She let me in. We're sitting there. I'm talking to him. He was very thirsty. Got him water. Next thing you know, the nurse practitioner comes in. And this is what she said. Did you not have someone ask me a question about you being with your husband? And I said, and all of me wanted to say no and just lie. And I said, yes. She says, you need to leave. And I looked at her, right? And I thought about it. And I said, I don't think this is worth the fight. So she said, if you don't leave, a doctor will not see him. And this is what happened. So with tears in my eyes, I left him. Now ask me whether a doctor spoke to me afterwards. Nothing. So now I'm talking to my husband saying, what happened? What did they say? I don't know. Are they going to give you anything? I don't know. I made umpteen calls in this province to get the Paxlovid, even to Tim, and it didn't happen. Now, saying that, we've had the vaccines. Roger has had COVID 3 times. I've had it once. Now, he's immune compromised, so we expect that. I take care of him at home. The other thing is, wonderful me, I fell, hurt this arm. We thought maybe, I went into the emergency room, sat there forever. I finally got up because I was in so much pain and asked them how much longer, and they said, we have no doctors. Are you fixing that? So I went and sat down. Someone's coughing. By the way, that's the second time that Roger got COVID. And then I went in, and they said, we're going to put you in this supply closet, because that's the only space we have. And I sat in the supply closet. Good thing I have a good sense of humor, because every time a nurse came in, I said, oh, is there anything I can help you with? At which point, when it came time to take the x-rays, because they thought, you know, my shoulder could have been broken or whatever, they said, hurry up, move really fast, because we have an emergency coming in. And I had to think about this. What am I? They said, if we don't do this quickly, we won't be able to do it. That, you know what? For someone that's 74 and all of a sudden realized that my worth wasn't even there, and I was sympathetic with the nurses because they told me about the hours they were working. I want to know what we're doing about Yarmouth Hospital, which is really a great hospital, but finances need to be there. We don't need to be shuttled into Halifax all the time or listen to everybody talking about the money that goes into Halifax. I'm working with dementia. Yeah. So anyhow, and there's quite a few people here that are coping with dementia, but I have to be his primary caretaker. So am I greatly disappointed? Yes, I am. But I didn't expect this. I didn't expect you to sit there and say, oh yeah, by the way, in February this is coming, or down the line this is coming. We're working on getting nurses. Or to have someone retired stand up and say, hey, I'll go back. I'm a veterinary technologist. I could go back. Yeah, this is very, very sad for our community. I have a friend who's waiting for a hip replacement. 3 years.
So thank you for sharing your experience, and my apologies for it being so negative.
There are no more apologies, not seeing what. There were people that were actually leaving that were probably worse condition than me because they just couldn't wait anymore. For me to hear, oh, there's no doctors here.
So to update your question on the redevelopment, I can tell you, and I'm going to look at Tracy, so she'll confirm with a nod. So we have been working on the redevelopment. So the funding that you describe that Yarmouth received, there has been a team of both operational and clinical leaders that have been working really hard together with redevelopment staff, and the conceptual design for the new space is complete. It has been submitted for review and approval for the next phase. So the site is not only very committed to improving the the Yarmouth ED. Yep. Yeah, so maybe what we'll do is we'll take your name and telephone number. So maybe what we'll do is we'll post online where the questions and answers are, what the timeline is. Tracy can speak to the nuances of the date. She's leading, co-leading the team here, but we can provide you some details for certain.
So the schematic design is going back to government probably April 1st. It'll have to go to the registry then to look to get funding for the actual build piece. But we have engaged teams. Paul Legier, who's the physician lead, as well as some nurses. We actually toured some EDs around the province to make sure that we looked at what are going to be our needs for the next 10, 20 years from an emergency department point of view to plan appropriately and to make sure that we're, thinking ahead so that we can provide the care that's necessary down the road. So in April, it should go back to government for consideration.
So when is it, well, wait a minute, we were told about this emergency and the money before COVID.
So the money was for the functional design and a schematic design. It wasn't for a build. So there's different phases.
When we know more, we'll certainly share more. And what we do know now, we'll make sure is communicated in the Q&As on the website for certain.
Okay, and I told you this might happen, that we'd get to the end of our time, and we are, unfortunately. So it is, we only have 2 hours for today. We are heading to Shelburne for another community conversation. So if you have ongoing questions, please write them on your card with your contact information, and someone will get back to you. That's guaranteed. And I just want to say thank you to everyone for coming, and thank you for your thoughtful questions.